Hi everybody, it's Matt here, your local friendly neighbourhood vestibular migraine sufferer. So, returning with a video today on a subject that I've wanted to cover for some time on the channel. I do get asked questions about it. I don't know that much about it, but I've always intended to cover it on the channel at some point. And it's around a treatment for vestibular migraine, or a treatment option. And that treatment option is Botox. So, I'm sure most of you have heard of Botox or roughly know what Botox is. In the modern era, it's kind of probably all over the place. Well, it is all over the place now, isn't it? Particularly in, your favourite celebrities and Hollywood stars, etc. But essentially, what is Botox, firstly? Well, it is a chemical that paralyses muscles. So it's caught on as a treatment for, a cosmetic treatment to try and limit the amount of wrinkles you might get in your forehead or your face. So because it paralyzes muscles, one of the causes of wrinkles, other than smoking and sun worshipping and just age, is that you move your muscles, don't you, when you make facial expressions. It is the movement of muscles. So for someone like me, for example, I frown a lot when I'm typing at a computer, looking at a spreadsheet. So over time you can see that I've got a few wrinkles in my forehead, to be expected of a chap of my meager age. So over time, obviously, people have looked for cosmetic treatments to make themselves look younger, and Botox was one that has gone into mainstream circulation over the years because it does paralyse those muscles, and it means we're not frowning as much, and then therefore, in theory, we're not going to get as many wrinkles. So, how then has Botox got associated with migraine treatment? So if we take regular migraine first, so it was noticed over time that people who'd come for cosmetic surgery using Botox, it was noted that over time, those who also suffered with regular migraines, headache pain, started to show a reduction in the amount of episodes that were occurring, which happened after they'd been receiving Botox injections for cosmetic purposes. So I imagine research and science looked into it a bit more, and down the line it has become something of a treatment certainly for regular migraine. And from my understanding is that scientists and medics don't know totally why it works in terms of, can have some effect, works sometimes for some people when it comes to regular migraine. But they think it's to do with Botox also having like a knock-on effect of freezing neurotransmitters in our body, and the neurotransmitters that transmit pain. So essentially, it's reducing pain when episodes occur, is my understanding. I might be slightly wrong. Please don't quote me on it. I am not a Botox expert, nor am I a scientist or doctor. So therefore, it's been used for treating regular migraine. Doctors have a theory as to why it works, but they don't know for sure. Often can be the case with medicine as well. Sometimes some things start working, and it's usually they were created for one thing and then used for something else. So where do we stand then when it comes to vestibular migraine and Botox? So firstly, I think it's worth just considering. Let's assume for a second it can work for some vestibular migraine patients. What exactly could be happening in our bodies? What is Botox doing to help a vestibular migraine sufferer? And this is, for me, total hypothesizing here. Do not quote me on this at all. This is just me speculating because I generally don't know. I will first say there's probably not been an awful lot of research on it yet, because there isn't that much research on vestibular migraine. Let's all be honest, we all know that. A lot of doctors don't know about it, and it needs a lot more research and more money and more investment and more people in the public speaking up about it to grow that understanding. So I would doubt there's been an awful lot of research to explain if indeed it can help vestibular migraine sufferers, and if it can, then why. So if I'm thinking about, firstly, let's assume it does help vestibular migraine sufferers or some sufferers, why might that be? Well, thinking about what we've just talked about Botox, it might well be that the Botox is freezing neurotransmitters that maybe do things in our body, for example, that would be symptoms we would see with vestibular migraine. So maybe it's doing a little bit of mitigation in terms of sensory overload. When you've got loads of movement traffic in the supermarket, maybe it's dampening that down in some way. Maybe it's dampening down also the elements of oversensitivity with photophobia and light. It could be those things. It could be that it's doing something to something muscular. Who knows? And I know it's designed to paralyze muscles, but maybe that in somehow is paralyzing or relaxing muscles maybe that are in our head. Because as I've said before, one possible cause for some people of vestibular issues is bad necks and muscular problems in the neck. So maybe it's doing something to relax those muscles in the back of the head, the neck, etc., that then gives relief from vestibular migraine symptoms. So that's firstly what it might do if it is having an effect on any vestibular migraine patient. But that is all speculation, my own hypothesizing, and I don't think there's been the research there to fully understand it. But then the second kind of then part of my musing is, has it had any impact? Does it have any impact on vestibular migraine sufferers? So my understanding is that it does, that some vestibular migraine sufferers have got some relief from Botox, certainly from certain people I've heard from through this channel. So there must be something in it. It clearly does work for some people, as it does for the regular migraine. It works for some people and helps them with their condition. And from what I gather from the small amount of people I've heard from who've mentioned Botox to me as vestibular migraine sufferers, they're mentioning it to me because they have had some relief from it. So again, very thin kind of evidence base, but it kind of maybe at least allows us to assume that perhaps it works for some vestibular migraine sufferers. So where does that leave us then? So hopefully by talking about it on this channel, it raises awareness of it as a treatment. If you didn't know, if you look at my videos fairly regularly when I do a new one, and if you've not heard about Botox as an option before, then it's worth talking about to raise that awareness. And it might be then that you go on to try it at some point. And so I'm not here to give a recommendation to say, yes, it works for vestibular migraine, go out and get it. Because as I said, the evidence is just not there. But my view always is that it's worth trying different things to try and treat vestibular migraine. So I was lucky in the sense that regular medication has pretty much brought my vestibular migraine under complete control. But also with that, there are other mitigations that I did at the time. So switching my diet, and then the FL41 glasses that I do often bang on about on this channel were a great mitigation for me with the light sensitivity and that kind of thing. So there are people as well out there that will go the more natural way, where they will find like maybe herbs that help them, or types of food, or vitamins, which is absolutely fine. There will be a multitude of things that will help different people. So therefore I would say Botox probably goes into, imagine you had like a portfolio or a big locker of possible different treatments. It sounds to me like Botox is one of those that should go into that locker as a possible option for someone to explore who is struggling with vestibular migraine and hasn't had any joy with some of the treatments I've already mentioned in my video. So let's keep it on the table. That's all I'm saying. And it's not for me to take it off the table, but it's not for me to also then recommend it to everybody to try. It might help you. And if it might help you, then let's keep it, on the table. Keep it on the table for yourself, that if you're not having any luck with all the things I've mentioned, maybe that's something to pursue if you can. So there we go. That's Botox. So before I finish, I'll just say that if anyone out there is getting Botox for cosmetic reasons, it makes me chuckle, because my brother, who is my twin brother, he jokes because now we're over a certain age that he's thinking about getting Botox. And I say jokes, he doesn't joke, he actually is generally meaning it, because he's someone who's even more vain than me. But I'm not a massive fan of cosmetic surgery on the face. I have no problem, for example, with hair transplants. I think they're a great invention. Not that I've had one, but I think they're great for men to offer men hope for losing hair, and indeed women, because of course some women can lose their hair. If a woman, it makes her feel better, for example, having Botox, or indeed a man, knock yourselves out. But what I think where my limit with, cosmetic surgery on the face, particularly of women, is when they have those lips done and they end up looking like they've been stung by a load of bees, like that Macaulay Culkin film, or Pete Burns. If you're in the UK and you've heard of Pete Burns, just think how he looked. Perhaps for American folks out there. Think about Mickey Rourke, the actor, absolutely ruin themselves with cosmetic surgery, and they get them. I can't remember what the chemical is in the lips, and they just blow up, and you just think you just spoil yourself, love. So I just say, any girls, women out there, just grow old naturally, because to be honest, most women are like a fine wine, and they get better with age anyway. So there we go. But it's entirely up to you what you do. Of course, it's your life. So that's Botox for you. So happy to do another video on this at some point. But do put in what would be great actually if you found this video because you're looking for a treatment where nothing's worked, and you might be thinking about Botox for vestibular migraine. If people who have used it for vestibular migraine and had some success, some joy, please start putting in the messengers. And of course, then people who are coming here will probably benefit from your experience, and you'll be able to give them some steers and some advice. So if you had your success, stick it in the comments below with the old Botox, and that might be a treatment option for you. So I think that's probably me rambling on enough. I do hope that you are doing okay. If you know, and I know that's very hard if you're going through a particularly awful time in a chronic period. But as I always say at the end of my videos, as you were, you'll be again. And that's enough from me for now. I'll see you all soon, guys. Take care. The wrinkle. So the idea, a pigeon has just appeared to join the video on my window, hence being made jump. Sorry about that, guys. Hello, pigeon. I'm doing a video here. You can probably see him strutting around out there. He's just gone that way. That's one way to get made jump by a bloody pigeon. He's back, look, here he is. This could be an outtake. My video got interrupted by a pigeon, so this can be the outtake. Bye bye, pigeon.